Hi, I'm Erin Gordon, one of the CPMC genetic counselors. Before you view your results, I'd like to give you some important information about what your results can and cannot tell you. When viewing your results for any condition, it's important to remember that the testing done by the CPMC only looks at your risk of certain diseases, but cannot diagnose a medical condition. If you think you're having symptoms of a condition, please contact your medical provider. Prostate cancer is a cancer that forms in a small gland called the prostate gland in the male reproductive system. The prostate gland makes the fluid that helps nourish and transport sperm. Like all cancer, prostate cancer occurs when a group of cells in the prostate grow and divide out of control. 1 in 6 men will be diagnosed with prostate cancer in their lifetime, making it the most common cancer in men in the United States. Although not everyone with prostate cancer has symptoms, some of the early signs of prostate cancer may include the frequent need to urinate, trouble urinating, starting and stopping while urinating, decreased force in the urine stream, and blood in the urine or semen. It's important that you tell your doctor if you're having any of these symptoms. There are many factors that make up your overall risk for developing prostate cancer. Some of these factors you can change, and some you cannot. One of the strongest risk factors for prostate cancer is age. Although prostate cancer can occur in younger men on rare occasion, most cases of prostate cancer occur in men over the age of 50. Another risk factor that you cannot change is family history. Men who have a family history of prostate cancer have an increased risk compared to men who do not have a family history. African American ancestry is also a risk factor. Additional risk factors include eating a high-fat diet and being overweight. Studies have shown that men who are overweight may be at greater risk of dying of prostate cancer than men who are not overweight. Eating a healthy diet and exercising regularly can help you maintain a healthy weight. In addition to the non-genetic risk factors that we've just listed, there's a strong genetic component to prostate cancer. It's estimated that about 42% of the risk for developing prostate cancer is due to genetic risk factors, while the remaining 58% of the risk is due to non-genetic risk factors. Since there are often no early signs or symptoms of prostate cancer, screening tests may help with early detection. Current screening tests include a blood test called the prostate-specific antigen, or PSA test, and a physical exam of the prostate. Your doctor may use both of these methods to screen for prostate cancer. The American Cancer Society and other major medical organizations recommend that prostate cancer screening begin at age 50 for men with at least a 10-year life expectancy, and that screening be offered every year. It may be appropriate to start screening at an earlier age for men at high risk, such as those with a family history of prostate cancer and men of African American ancestry. It's not possible to diagnose prostate cancer through genetic testing. Prostate cancer must be diagnosed by a physician. If prostate cancer is suspected based on a patient's symptoms or screening tests, a biopsy of the prostate may be done to confirm or rule out the diagnosis. Prostate cancer cannot be prevented. However, getting regular exercise may reduce the risk of developing advanced prostate cancer. Now let's talk more about your CPMC result and genetic risk for prostate cancer. Remember that we all have 2 copies of every gene. We inherit 1 copy from our mother and 1 from our father. This means that for every genetic variant the CPMC study looks at, you can have either 0, 1, or 2 copies of the genetic risk variant. Having 1 or 2 copies of the risk variant gives you an increased risk for developing prostate cancer compared to people who have 0 copies of the risk variant. Your results will tell you how many copies of the risk variant you have and how your genetic risk variant compares to someone with 0 copies. The maximum and minimum relative risk for each risk factor is displayed by moving your mouse over the top and bottom of the gray cylinder. In this example, the maximum relative risk due to having 2 copies of the risk variant is 1.5. The minimum relative risk due to having 0 copies of the risk variant is 1.0. In this example, the participant has 2 copies of the genetic risk variant. Having 2 copies of this risk variant means that this participant is 1.5 times or 50% more likely to develop prostate cancer than a participant who has 0 copies of the risk variant. Learning that you have a genetic risk variant that has been associated with prostate cancer means that your genetic risk due to the specific risk variant reported is higher than people who do not have the variant. Currently, the CPMC is only looking at one genetic variant for each condition, but there are many more genetic variants that may influence your risk of developing each condition. Having 1 or 2 copies of a risk variant does not diagnose you with prostate cancer and does not guarantee that you will have or develop prostate cancer in the future. If you are found to have an increased risk for prostate cancer based on your genetic variant results, your family history, or other risk factors, there are things that you can do to reduce your risk. You may want to share your CPMC result with your healthcare provider. Your healthcare provider may assess your risk for prostate cancer from other risk factors not included in the CPMC, such as the results of blood tests, like the PSA test, or results of a physical exam. Or he or she may suggest lifestyle changes, such as an exercise program, to help lower your risk. You may also be able to reduce your risk by starting or continuing healthy behaviors like exercising regularly and eating a low-fat, balanced diet. Learning that you do not have a genetic variant associated with prostate cancer means that your genetic risk due to the specific variant is lower than people who do have the genetic variant. If you do not have the genetic risk variant, you may still be at risk for prostate cancer due to other risk factors or other genetic variants not assessed by the CPMC. Even if you do not have a genetic variant risk, you may still benefit from reducing your risk by starting or continuing healthy behaviors like exercising regularly and eating a healthy and balanced diet. To summarize, here are some key points to remember about your CPMC results. Learning that you have a genetic variant associated with prostate cancer means that your risk is higher than people who do not have the risk variant. This result is one more piece of information for you and your doctor to be aware of when considering how many risk factors you have for prostate cancer. Prostate cancer is a complex disease, which means that it's caused by a combination of genetic variants in multiple genes and by non-genetic factors like age, diet, and exercise. No single genetic variant causes prostate cancer, so no single genetic variant is able to completely predict your risk of prostate cancer. As the study continues and we learn more about other genetic variants, your estimated genetic risk for prostate cancer may change. Remember that regardless of your genetic variant result, you can make changes to lower your risk of developing prostate cancer. If you have questions about your results, please consider discussing them with your healthcare provider, contact a CPMC genetic counselor, or attend one of our educational sessions.